vaccine hesitancy now, which of course has been a major focus of this vaccine rollout as well. Just want to let you know, as you probably know, a CNN poll this week found more than 25% of Americans have not gotten a vaccine and say they don't want to get one. So to combat this, the Biden administration is launching what is essentially a marketing campaign geared toward those who are hesitant about getting a shot. And we know the president has appealed directly to doctors and community leaders to help. Do you think that's enough?
Well, I'll tell you what I've seen myself in the last year. I've talked to hundreds of people, for instance, who are incarcerated. And many of them, and also many staff, actually, many correctional staff, have been very reluctant or worried. But when they are provided with the information, and really importantly, when a credible messenger brings them the information to them, I find almost across the board, people have a good response. So, for instance, I'm a white male doctor. I may not be the best messenger for a lot of people. And so thinking about who is it that people trust and how can we get this vital information about life-saving vaccines to people in a way that they're going to respond to, that is our job in public health. And we have to do a much, much better job of it.
Well, that's a great point. A lot of minorities say that if they see someone that looks like them getting the vaccine, obviously that will make them trust it more readily.
Well, I think also, the world I work in prisons and jails, many of the people who are behind bars have very good reason not to trust the authorities in these places. There's a very deep level of earned mistrust there. And so we have to think creatively. One of the measures that's really critical in the community is community health workers. That's a model that we can use in a lot of places. But thinking about who the messengers are is as critical right now as what the message is.